Hey, happy October the 16th, everyone. I'm Terry Myckatyn, and today I'm going to be doing a West County plastic surgeons Facebook Live looking at revision breast augmentation. So specifically, what I'm doing today is basically going to talk about why women may choose to have revision breast augmentation, what the reasons for that are, um, what kind of procedures we do, what types of materials are used, how successful they are, and that sort of thing. Also, thank you very much. I recognize that we've received some questions in advance of this Facebook Live, so I will be sure to answer all the questions that were submitted. And of course, please feel free to write a comment, and I'll do my best to respond and answer those questions as well. So again, thank you very much for signing in, and we'll get going. So and of course, you can always go back and find these Facebook Lives later on so you can see the whole thing if you missed part of it. So the first thing is, why would somebody have a revision breast augmentation? So the reality is that breast augmentations, at some point in time, a woman has breast implants, she'll probably need another operation. So there's lots of reasons for this. One would be a deflated breast implant. Another would be what's called a capsular contracture. So deflations, also called leaks or ruptures, they can happen with any type of breast implant, whether it be silicone or saline shaped, gummy bear, all these types of implants. And so if it's a saline implant, we would pick that up just because essentially the breast deflates within hours and the breast volume rapidly decreases. Or what can happen is there could be a leak of a silicone implant. That's a little tougher to pick up. Sometimes our patient or the physician can't actually pick that up just by looking or examining. And so in those cases, an MRI exam is the best way to do that. So that's MRI, or magnetic resonance imaging. It's a type of scan that's performed, and it is probably the best way to pick up a leak of a silicone implant. And so if that occurs, then those implants need to be removed, cleaned up, and either replaced or left out. Another major reason for needing a revision would be a capsular contracture. So a capsular contracture is when somebody is developing tightness or thickness or distortion of their breast implant. So the way that that would look to our patients would be a breast implant's been there for a while, and then all of a sudden it feels firmer and tighter. Often the fold underneath the implant begins to ride up. Often the footprint or the dimensions of the implant begin to sort of shrink in. Often it looks like it's projecting more. It can be associated with pain or discomfort. So those are some of the major reasons why. And that's called a capsular contracture. And really, you may see or read things back in the day. Surgeons would try to quote unquote pop the implant, where they would squeeze the implant to make it softer. That is what was done, decades ago. But nowadays, the recommendation is you just go back in there and you take out that scar tissue. And that's called a capsular contracture. So those revisions can be a little more tricky than a leak, because when we're removing a capsular contracture, we're not just removing the breast implant, but we're removing that scar tissue that formed around it. And it changes the way that the pocket that the implant is in feels. It can be a little looser, a little bit more spread out. And so sometimes that would require a tightening of that pocket. Just so everybody knows, I've noticed that one of our guests has asked if we can talk a little bit about rhinoplasty. Today is about breast augmentation revision, but we are doing a whole series on facial procedures here coming up in the next couple weeks. So rhinoplasty is a big topic to cover, and so we're more than happy to do so. But we'll probably start that. I think we're starting one of our first facial cosmetic surgery Facebooks next week, actually. So please stay tuned for that. So in terms of the way that we do revision, so Other reasons would be that the implant is not in the correct location. So the breast implant can fall, it can move to the side, it can be in the wrong position, and we call that malposition. So the implant, so on me, but essentially, so the breast implant can drop down a little bit. And so you can imagine if a fold of the breast is here, and then the breast implant drops, it'll look lower. And if the nipple is here, but the implant drops, it makes the nipple look too high. So it's here, the implant drops, now the nipple's too high on the breast. And so as a result, it can make the nipples look like they're skyward. It can make the scar underneath where the implant was put in look more visible, and that's called bottoming out. Sometimes the implants can shift to the side, and we call that lateral malposition. And then rarely there's another entity called symastia, where the two implant pockets actually communicate with one another, and it looks like the two implants are fused. More common, we can see a little bit of webbing or tenting between the two breasts, which isn't truly symastia, but it can cause the skin between the two breasts to lift up a little bit. So then the question is, so how do you deal with all this stuff? Well, so first of all, most of these revisions are about support, meaning we have to figure out a way to hold the breast implant where we want it. So if the tendency is for the implant to drop down, we need something under the implant to hold it up. If it wants to go to the side, something on the side like a retaining wall to hold it in. Or if the implant wants to move in or the two pockets communicate, we need to put something in there to prevent them from doing so. So when a breast implant is put in, a capsule forms around the implant. So this is sort of a specialized type of scar tissue that forms. And that capsule is actually something that the plastic surgeon can use to try and help refine the pocket in which the breast implant sits. So you'll see plastic surgeons refer to something called a capsulorrhaphy. And what that means is we're essentially sewing that lining capsule to itself or tightening that lining capsule so that the pocket that the implant sits in gets reconfigured so that the implant can sit in the correct place. But what can sometimes happen is that capsule can be very flimsy, or sometimes in a capsular contracture, we have to remove that capsule. And so when that happens, we don't have that same support. So that's when we start using, over the last several years, mesh products that have been introduced on the market to try to hold those implants in position. A lot of the work that we do with mesh products and breast implants actually started in breast cancer reconstruction. So when a woman has had a mastectomy and all that tissue has been removed, we've been using those mesh products to hold the breast implants in the correct location. And so as time has gone on, we've recognized that those mesh products can also be used to help women who have issues with their breast implants in cosmetic surgery as well. So a few years ago, there was a product that we still use in breast reconstruction called Alloderm that was used, and that's basically cadaver skin. However, that product kind of went by the wayside a little bit in terms of cosmetics because it's quite expensive. Subsequently, there was a product called Stratus, which is basically tissue from a pig, actually, which we use quite a bit for support. That was quite expensive. And then more recently, we changed to one product that was called Siri, and then most commonly something called Galaflex. So Galaflex is it's a sort of an artificial mesh, and your body's own cells can grow into it. And this mesh product can be placed inside the pocket to help shape the pocket and then support the breast implant. I'm going to take a couple of questions at this point. So I'm just looking at the ones we have so far. So one is, if you have implants removed after a mastectomy reconstruction, what would the average healing time be? So if this is somebody who's had breast cancer and has had a mastectomy and implants are there, but then they've been taken out. Everybody's a little different. Typically, the capsule and the implant are both removed at the same time. A drain tube is typically placed. So I would say that the drain is in there for roughly a week. And in terms of healing time, patients are up and about feeling pretty reasonably at about a week. But certainly there can be some swelling for a few weeks after surgery and some redness of the surgical incision, even for a couple months after surgery. But that's, relatively speaking, a pretty quick recovery. Another person asked the question, if the implants appear flat or has turned a weird position, is this something to be concerned about only a few years post-surgery? So yeah, if there's a change in that shape of the implant, that's something that you should see your plastic surgeon about. If it's at a shifted position, then that could be an issue with malposition. If it looks like it looks like it's in the same spot, but the front surface is flat, it could be that the implant is flipped or rotated. Another possibility is that the skin has contracted around it to flatten the shape of the implant. So all of those are possible. That could be an implant malposition, or that could be a capsular contracture, or perhaps a turn of the implant. So that would be best addressed by your plastic surgeon. They can have a good look at it. Sometimes we would get a mammogram or an ultrasound or MRI to look to see what's going on with that implant. And I will say that in general, when women have breast implants, they're not there forever. So if you're somebody who's already had their implants, for 15, 20 years, even if everything seems fine, it's probably not a bad idea to be checked out by your plastic surgeon just to make sure that that's the case. And if it's a silicone implant, they should probably order an MRI just to make sure that the implant remains intact. Another question that was asked is, would implant surgery changes be the same for a double mastectomy? So it depends. If we're talking about changing out an implant, so the implants that are used in breast reconstruction are the same implants options that are used in breast augmentation. As plastic surgeons, we tend to favor certain types of implants more for reconstruction and others more for cosmetic surgery usually, but all the implants are available for both things, for reconstruction or for cosmetic surgery. So in terms of that, we think of things a little differently. So if somebody's had a mastectomy, they have very little natural breast tissue in front of that implant. So there's more issues with rippling or contour waves on the surface of the skin. And then also, if somebody's had a mastectomy, they don't have a lot of projection of their breast because they don't have normal breast tissue on top of the implant. So to try to push the breast out a little bit more and give more projection, we tend to use more high projecting implants. So I have a sort of a little bit of a visual demonstration here on my desk, and I'll try to angle the camera down so you can see this. But here are a few different types of implants. And I think what you can appreciate, so this is a full projecting implant. So for a particular width, it has the most projection. So it basically sticks out the most. These implants we most commonly use in breast reconstruction, or if somebody wants a lot of projection. This next is sort of in the middle of the road. So for a given width, it has a little bit less projection. This is a full projecting implant. We'll use this in some reconstruction, and then in women who want cosmetic surgery want a little bit more projection. And then this final one is a moderate projecting device. We rarely use these in reconstruction, but we tend to use a fair number of them in cosmetic surgery. And that's because a woman will already have some natural breast tissue in front of that implant. So they don't need that extra projection to get the look that they're going for. So projection is the amount that the implant sticks out for a given width. You can also see from these implants that the devices have different degrees of gel. So I'll show you what that means. So So this is a cohesive implant. So if you see when it sits up, it really tends to maintain its shape. This next one is called the soft touch, and I'll kind of try to show you this difference. But I think what you can appreciate, I hope, is that this implant here collapses more than this implant. And as a result, there's more, it doesn't hold its upper pole as well, and it has more ripples. The one with the firmer gel tends to sit up more and has fewer ripples, and it gives more fullness in the upper part of the breast. And then the final one that I'll show you is this is a responsive gel. So you can see this one really collapses, but it's nice and soft. So if somebody's priority is that they want a softer breast, then this one may be the one that they choose. But they'll notice it doesn't hold as much of the upper pole fullness. And what that means inside the body is it'll assume more of a teardrop shape, even though it's a round implant. But again, the downside is you may feel some more ripples. Now for cosmetic surgery, if you already have a reasonable amount of natural breast tissue in front of that, you may really not notice those ripples very much, and that may be a perfectly fine implant for you. So it really depends on the situation. I'm just going to look at some more questions here. And one is it common to add more fat grafting? So that's a great question. So fat grafting is when we take fat from one part of the body using liposuction, and then we transfer it to another area, in this case, the breasts. We can use fat grafting in a whole bunch of different scenarios. One scenario is when we do it for breast reconstruction, but we could also use it in cosmetic surgery. So why would you use it in cosmetic surgery? So there's a couple reasons. One would be if you notice a few ripples. So for example, maybe you wanted the softness of one of these more soft touch implants, but the problem is you notice these ripples and this collapse here that can occur. Well, what you can do is you still put in that type of an implant because it's softer and you like that teardrop look, but to address some of those ripples, you would then inject fat that we took from elsewhere to smoothen out that contour and give you a softer look. Also, sometimes, or almost all the time, women have some difference, sometimes more subtle, between the size and the shape of a left versus a right breast. You may think that, well, if that's the case, maybe just put a little bit bigger implant in the smaller one and a little smaller implant in the larger breast. But in reality, it's typically not that easy. Typically, the way that the size between the two differs isn't going to be well addressed by just changing the size of the implant. But with fat grafting, we can sometimes use that as a tool to sort of spot change the shape or the volume of the breast. So we can maybe add just a little bit of fat to the originally smaller breast to kind of bring it up. Also, sometimes there can be little contours that somebody wants improved. If somebody feels like the contour of the upper pole of the breast is too severe and they want us to smoothen that out, we can use fat grafting there as well. And then the other time that we would use fat grafting is there are occasions where maybe somebody has had a capsular contracture or a breast implant, we've removed it, and perhaps they've decided they don't want breast implants anymore, but they still want a little bit of volume there. So we will do fat grafting in those cases as well to add some of their own fat to the natural breast to give them some volume if they've chosen not to have breast implants anymore. Yeah, so I'm just going to look ahead here and see if anybody has any other questions. So I'll sort of sit here and look at that for a few more minutes. I would also encourage you when you're contemplating having a revision or a touch-up of a previous breast augmentation to see a board-certified plastic surgeon. You definitely want to see somebody who has a lot of experience in dealing with these types of things. One of the ways in our practice, West County plastic surgeons, that we've been able to be more comfortable with these more complicated revision procedures is honestly because we also do quite a bit of breast cancer reconstruction. So we've seen some of the more complicated challenges that occur from breast cancer and have been able to adopt some of those techniques to make more complex cosmetic cases a little bit more manageable as well. In terms of costs, that's something that people, understandably want to know about. Often the revision procedures are more complicated than the original procedure. Sometimes we have to use different materials than we would have used, and sometimes these operations take longer. So at times, these operations can be more expensive than the original augmentation. However, it also should be known that typically with breast implants, when women have, for example, their first breast augmentation, they'll get a card with a serial number and information about that implant. And many of the manufacturers who make these breast implants have warranties on the implants and potential, and which can include a rupture or a capsular contracture. And also, in addition to replacing the implant, they can also provide money towards a repeat surgery. So it's important to know that when you are contemplating whether or not you wish to proceed with a revision breast augmentation. All right, it doesn't look like we have any other questions today. I encourage you to keep an eye on our Facebook page. We'll be doing these types of Facebook Lives every week or every second week. And again, I also encourage you to remember that this was a Breast Cancer Awareness Month. So I'm one of the ambassadors for the Komen a Big Wig fundraiser, which is a fundraiser to raise funds for breast cancer research and breast cancer support. So if you go to our West County Plastic Surgeons Facebook page, there is a button there. So if you do choose to donate on our behalf, that would be great. It doesn't go to us, it goes to the Komen Foundation, Susan G. Komen. Again, thank you very much for tuning in, and we look forward to speaking to you about other topics in plastic surgery in the near future. Thank you.